Evening to everyone. Am I audible?
Yeah, you're audible now, Doctor.
Good evening, sir.
Welcome to everyone. So, as we kickstart this session of ours, let me welcome you all. In the north of India, it is very cold. In the south of India, it may be raining. In the west of India, it is very pleasant. In the east of India, well, wherever it is, Corona is there everywhere. We've got chilled Corona, that's in most people's fridges, in the shops, and we've got chilled coronavirus, which is also affecting a lot of our country. Let me just say that, this session is essentially intended for questions to be raised, for you to get a little bit reassured about what's happening. And any questions that you raise, Sanjeet, our young friend, will compile all of this and send it across to me, and we will prepare answers for this and send it back to you. So maybe what I can suggest and recommend here is that you look at this session as a place where you can create questions in your mind, and at the end of it, we will leave 15 minutes for a question answer session, and the rest can be sent on email to us. So this question that I'm going to ask of all of you, we keep reading in the media, we keep talking about what's happening. What is the new normal? Is this the new normal? Is it the beginning of the end? Or is it, oh my God, it's my Omicron? That's what we have to essentially look at. It is, what is our own personal reaction to this? That's what we need to look at. So essentially what we will be doing is trying to give you a little bit of enabling advice to empower you with the correct knowledge. So I would say it's not yet, oh my God, it is still Omicron. It is Omicron only. Just to give you a quick reminder, by now, everyone is a public health specialist. All of our colleagues who are on this session, all of my friends, my neighbors, my relatives, all of them are experts now. Sometimes I even begin to question what I know, because they seem to know far more than me. So I have stopped reading the newspaper. I stopped reading WhatsApp forwards and messages, very simply for you all to know the correct information. A pandemic essentially just means widespread of a disease. It doesn't indicate anything about the severity of a disease. So the same way you see on WhatsApp or on Facebook or on other social media forms, if I say WhatsApp is transmitted by sticking a finger in your nose, that will transmit to millions of people in 2 minutes, it will reach across. But if I give correct information, WhatsApp will not forward good messages. Good information doesn't spread, bad information spreads. If you say that a person named Radha has unzipped his trousers, it's going to go all across the country. But if you say he is speaking sense, no one's going to forward it at all. That is the way social media is. So what we are facing is an infodemic. And ladies and gentlemen, my purpose in the next 20 minutes or so, or actually 30 minutes or so, would be to just broadly give you an overview to reassure you. The purpose is reassurance. I'm certain you would want a little bit of sanity at this juncture of time. So what do we know so far? You all already know that the disease is COVID-19, and that is caused by the coronavirus. In case you're wondering about those 5 little balls there, that is those variants that keep troubling us. They are not new viruses. They are just variants. It is like one badmash is replaced by a younger badmash or older badmash. It is the villain of Hindi pictures. It can be any new villain. A villain is a villain. It doesn't make a difference what his name is. What key points that we all must know? It is normal for a virus to evolve over time. It is absolutely normal. It's just the same way that you as children of your parents are not exactly the same as your father or your mother. You are different from them. So your children, if you have children, will not be the same as you. It is exactly like that. So why should a virus be any different? A virus is almost one of the basest forms of life. So when you look at it from that practical viewpoint, when you say there is uncertainty, absolute uncertainty, this is an evolving situation. When I'm explaining that, I'm trying to tell you, whoever tells you that he's an expert is actually just giving his own personal opinion. Everyone is entitled to that. Even my doorkeeper, my gardener, the housekeeping staff, they all have their own opinions. Well, this is the way of the social media. Everyone can have an opinion, but it doesn't necessarily make them know what is happening. So don't just blindly believe what is happening, and don't just blindly believe experts. This is a new disease. This is a new evolving situation. Everything is uncertain. So let's go with uncertainty. In the business world, you refer to a term called VUCA. volatile, uncertain times, etc., etc. Well, it's the same in medical science. You're shooting in the dark. What has been found definitely in the past 3 years, COVID appropriate behavior is effective. Vaccines do protect, definitely, they do protect. So when you have that look at going on in you, you need to understand that what we are looking at is three main things: variant of interest, variant of concern, and variant of consequence. What we are looking at, the highlighted red letters, that's variants of concern. Those are ones which we are concerned about. Now, this is this alpha, beta, delta, Omicron. There will be many more, maybe many more. It's not going to go out like this. This coronavirus is not that. It's firstly, you must understand, it's not an intelligent, sentient being. There is no coronavirus headquarters or Bharatiya Corona Party. There is nothing of that sort. There is no strategy being involved. It is surviving. A virus has to survive because a virus has to propagate. If it wants to stay alive, it has to propagate. It should not kill its host. So in the Marburg Ebola, which is in Africa, you have this a very dangerous hemorrhagic kind of fever. There it kills its patients. So it doesn't spread further like it's spreading right now. So it is a dead end for it. If you kill your patient, then what is the use? You will not survive. So you want to keep your patient alive and healthy. So that way the patient can transmit more. So variants have an impact on the transmissibility, the disease severity, and the efficacy of diagnosis, treatment, and vaccination. So when we know all of this, why do we need to get worried? Well, we get worried because we have news agencies, we have WhatsApp Gyanis who are saying this is the most mutated virus, as if it is Ravan with 10 heads and 10 arms and 10 feet. Well, if you got 10 feet, I'm certain you can't run fast enough because each leg is going to go in a different direction. So don't get worried too much by these mutations, so to say. What is important is the behavior. As they say in Hindi, niyat. What is the niyat of this the virus that is coming out? Well, that can only be told in retrospect. That is when we look back in time and say, yes, this is how the virus behaved. The rest, everything is conjecture. It is speculation. Now we've gotten just today's paper, Deltacron. I mean, what is this? A Transformers movie, the latest version. Deltacron, Babkacron, Tucon. Well, don't worry. There is a standard naming system that the scientists have evolved this based on the Greek lettering. So this Deltacron and all are rubbish. You can, I mean, it is Mera Baap Kaun hai? Tum jante ho kya? That's what coronavirus is asking you. You can come up with any combination of names. Doesn't make a difference. These are all laboratory anomalies. These are laboratory scientists who are happy naming these things. And that's why they named them alpha, beta, etc., etc. There was a plan to name a variant as Z, but we know that is XI, but we know who is named XI. So obviously the powers that be who are funded by that particular country did not want to name it as XI. So they changed the name. So these are the naming systems. It's in sequence. It's just the way that cyclones and hurricanes are named. The next variant will accordingly be called the next. So don't worry about that. And it's a very smart move by our country's government that they put pressure on the international community to change the nomenclature from the country name. Before it used to be the South African variant, the British variant, the Danish variant, and the Indian variant. Now we don't talk about it because 100 years from now, when history is examined, we do not want to have an Indian variant around. So we would rather call it Delta variant or Omicron variant or whatever. So it is a very strategic move, which we should be thankful that our people definitely do have the vision to do these kind of actions. It may sound very silly right now, but 100 years from now, we will not be talking of it like the Spanish flu, as if Spanish flu in 1918 affected only Spain. This is a game that, used to play as children. Something pops up, you bonk it on the head. It's a video game that used to be there. So it is the same thing. Variants will keep popping up. Our scientists and researchers and our WhatsApp Gyanis will keep coming up with threat theories, with treatments or with investigations for it. Don't worry. Simply, infection spreads person to person. That means from my breath to your breath to someone else's breath, it is going to spread through your respiratory system. That means in through your nose, going to your lungs. That is essentially how it spreads. It also spreads by direct transmission, where if I go sneeze, and that goes onto a door handle or it goes onto a lift button, and straight away I go and touch it and put it into my nose, there is a potential for transmission. Touching contaminated surfaces with your hands. This again, touching your eyes, your nose, your mouth after touching contaminated surfaces is direct transmission. I mean, indirect transmission. Common symptoms that we are seeing with Omicron. I mean, like I said again, oh my God, it's Omicron. Is actually, you need to take a chill pill on that. It's not, when I'm saying it's not as serious as it was thought to be, it means that it is highly transmissible. It is transmits faster, spreads faster, but it is not resulting in so much of morbidity or mortality as was seen with the second wave in India, the Delta variant which was roaming around. So don't be perturbed, don't be concerned overly much. An individual may have any, or he may have some, or he may have all of these symptoms: a runny nose, headache, fatigue, fever, sore throat, and strangely, there's no loss of smell this time. So you don't have to worry. But these may occur in any kind of respiratory illness. That is the key point you have to note. It could be the regular common cold that we all used to have before this pandemic came about. So don't worry. Just if you get a runny nose doesn't mean you got corona or you got Omicron. Omicron is not a separate disease or a separate virus by itself. It is just a variant. So in the earlier strains, we had different things: aches, pains, diarrhea, conjunctivitis. But now we've got simple things like you got tiredness and muscle aches. You might just have a headache. You could have a scratchy throat. You could have a running nose. That's it. It may be milder or it may not be milder. So far, what is the worst symptom? It is panic. What I'm just saying is here that this panic is what we have to avoid. This panic is what we have to look at and keep calm. That's my message to you all. Keep calm. To your families, to your friends, please tell them, don't panic. That is the basic thing. People of all ages can get infected. Now there are absolute numbers, there are population-based numbers. Now this third wave, will there be a fourth wave? What is this wave actually? I will be showing you some slides subsequently, which will also give you a look, a perception of what a wave actually means. If you see here, new cases per day. I have just, for interest's sake, taken the USA and India. And again, being the most powerful country in the world and the second largest country in the world, I've just contrasted them. And you would say, why aren't we adding China here? Well, the data that comes out of China, I wouldn't exactly trust it or rely on it. That's why I said what is more trustworthy is to see the data that comes out of these two countries. If you look at the graph for the US, you see they've had multiple waves. The brown line is the US line, if you can discern it, the one which is at its peak. And you look at India, we've had only 2 perceptible waves, whereas the US has had multiple waves. Now, there are many reasons for that. And those reasons, the Western world might say it is we don't test and we are hiding data. It's not so. It is how our nation's immunity is responding at a population level. That's as simple as that. It's got nothing to do with any other fudging of data or so to say. But when you translate it into per million, I mean, you would think that because we've got the largest population, second largest population in the world, that we might have that much more per million. But you see, even here, when you translated it to per million per day, still we are far, far lower than the United States of America. So this is a very heartening thing to note, that it is giving us some solace that maybe our immunity is slightly better than that of the Western world. But again, we should not take credit for it. In infectious diseases, never take credit is our credo in public health, because you never know how the human body behaves. And the human body as an individual, the human body as a population, how it will behave in Rajasthan, in Orissa, in Delhi, in Poona, in Karnataka, you do not know. So it's only time will tell. Maybe in 2030, when we write books on this thing, or a movie is made starring maybe Aishwarya Rai's son will be starring in a movie, and then you might have a movie talking about this. At that time, we'll come to know. Is there a cure for COVID-19? Well, there is no cure as yet, because it's a viral disease, but there is treatment. Now, why I put this slide here is, I'm just trying to tell you that when you go to the hospital, if you have to go to the hospital, do not do a Google search. Go to a doctor you can trust, go to a hospital system you can trust, let them handle it, because the treatment is based on consensus, based on current evidence. Now, there is conflicting information you will see in the social media. They will write a headline as something else, the text will be something else, because it's the headline that sells, it's the breaking news that is selling. So you need to be very careful of referring to Google Auntie for giving you information. So be careful. And doctors do not need you to give printouts to them, because they would have also read the scientific evidence rather than what you would have read, the non-medical evidence that is there. Do not pressure doctors into giving you treatments that do not work. Leave apart government guidelines, international guidelines. Let your treating doctor decide what is best for you, because he can treat the symptoms that you're facing at that point in time. Being a viral disease, the cure is not clear as yet. We talk of cocktails, antibody cocktails and all. Rich people are ready to keep advanced stocks for them. It will work or not work, we do not know. That is the basic thing. My mother too, she's been awarded recently a Doctor of Medicine degree, because every time something comes on WhatsApp, she thinks that's the truth. Half my time and effort is spent in convincing her that no. You got your son and your daughter-in-law who are doctors, ask us, not WhatsApp. So what I'm advising you, take everything that you get on social media with a bucket full of salt. Do not believe it and do not forward it. Do not be a party to it. Can we take any preventive medicines? That is something that people like to ask. Can we prevent this thing totally? Well, let me say that COVID appropriate behavior is the only effective medicine. Vitamins and Ayurvedic supplements are not a substitute for a healthy lifestyle. Those of you who smoke, stop smoking. It will be very harmful for you if you contract the infection. Stop smoking. Don't overdo steam inhalation. Too much steam can scald your lining of the respiratory tract. It will hurt you more than it benefits you. Salt water garglings are fine, but do everything within a limit. Vaccination is the latest weapon that we have. In 2020, we had simple stuff. We were just learning how this thing happens. In 2021, we got vaccination with us, which added an important weapon to our armamentarium. In 2022, we have started with boosters. Whether we will need more boosters or not, time will tell. It's an evolving field. No one knows anything. We are looking at the data. Our scientists at the national level are looking at the data. Internationally, there are groups which are looking at how this booster thing is working out, how it's going to pan out, what is the protection it provides. It's only time will tell. So let's keep it simple. Hands, face, space. We need fresh air. Keep your doors open, keep your windows open, exhaust ventilation wherever possible, circulate the air. If you're traveling by lift, keep the fan on. It may be cold, but the fan is going to blow the air down and away from your nose. So as far as possible, bring in fresh air wherever you are. Those of you in North India might be having polluted air. Can't help it. What do you prefer? Coronavirus filled air or polluted air? It's a choice you all have to make. So there are currently 3 types of vaccines, and maybe 4 Zydus also if you include it, and 5 the foreign vaccines that are coming about. These are various vaccines that are available. Don't be too concerned about which vaccine should you get or what vaccine should you take and when should you take it. Whichever vaccine you can get, it's okay. There is no vaccine that is bad among all of these. It's just a matter of getting whatever you have. In the race right now, it seems, going by the data that comes in, we've got very heartening scientific studies which have been done, which is showing that the vaccine, even the existing vaccine, is providing protection against Omicron and Delta, basically the coronavirus, is still behind in the race. So let's hope it continues that way. Desh sabka, sehat sabki. Vaccine for some, leading to vaccine for all, protection for some, and protection for all. That's what we have to understand. The vaccine will help to protect you, your family, and everyone around you. The vaccine, it provides immunity. That means it is not providing you protection that you will not get virus infection. It is just providing you some level of immunity. It is essentially going to be preventing severe infection, hospitalization, and death. These are the 3 important outcomes. Nowhere has it been talked about that it will prevent transmission from occurring. That means from person to person. So even if you're vaccinated, you still need to follow COVID appropriate behavior. And I'm very happy to say, as on today, the vaccines are still effective. That's why you see little Charlie Brown having a dancing jig there, just because it is proving to be effective still. The composition of the vaccines have not been changed as yet in India. Maybe going ahead in the years, it might change. This again, if you remember in the earlier slide, I spoke about an epidemic from an outbreak coming down to an epidemic to a pandemic and then becoming endemic. What it means is we will start getting to live with this virus. It will be a part of our systems. It will be just like the flu virus was there after 1918. It is still there around in the world. The same way, this coronavirus also will persist. So what we need to do is keep it simple. Many people may have to wait for their turn to get this vaccine or its booster. What you need to do as responsible citizens is promote vaccination among people. Those who are in your surroundings, in your neighborhood, promote, encourage, assist. We may have the largest number of people vaccinated, but that still doesn't make a difference till we have people covered by 2 doses. Let's not even get into the booster dose part right now. 2 doses itself will provide some level of immunity to our people, and it will promote herd immunity, so to say. Natural infection also does, but we do not want to take a chance with that natural infection turning very serious. Which is the better booster? I mean, do we have a choice actually right now when it's not available, when we're not able to get it? And by terming it precautionary dose, what do we mean when we say precautionary dose? Is it just spin? Is it just a semantics again? Well, whether you want to call it a precautionary dose or you want to call it a booster dose, what is simple is that those who are eligible should definitely get it. 9 months from the date of the second dose, I would say, don't be in the first in the line. You know, like you have movies going first day, first show. Don't stand first in the line, but definitely get in the line. Let other people get it in front of you. You'll see how they're responding, and see how they're reacting, and then you get your vaccination. This currently is only for the healthcare workers, frontline workers, and those above 60 years. It's just started like day before yesterday. Gradually, as and when coverage increases, the government will open it up for other categories also, because this is nothing but risk strategization of the existing vaccine pool that is there. So do not worry about this part overly much. Just think that yes, my meri bari aayegi. That's it. There are side effects, definitely, as in anything, there are side effects. Don't worry about the side effects. It is important that you must know, if you don't get any symptoms of the vaccine, that does not mean that your immune system is not responding to the vaccine. It's very important to note this last point that I've brought out here. There are common myths that you will not get infected if you are vaccinated. Well, that's not true. That these genetically modified vaccines, which are the ones in India, are not. So we need to understand that it is the Western ones, the mRNA vaccines, which are the ones which are genetically modified. And another myth that people think that you can stop taking COVID appropriate behavior once you're vaccinated. Well, that's not true at all. Vaccine hesitancy. Vaccination saves lives. You may not be aware of this, but one of the greatest achievements of the past century has been immunization. Immunization has saved billions of children and adults. There is no other way to look at it. Immunization in COVID, it will be only time that tells us how much it has saved. But as of now, the evidence says that it does protect people. Don't hesitate. Go ahead, vaccinate. Take whatever vaccine you get, whether it is the first dose, the second dose, or the booster. Let the system take care of you. Coming to COVID-19 in our children, we are always perplexed and worried what will happen to our children. Those of us who have children, I mean, if this was a live audience, I would have asked for a show of hands. But unfortunately, this is the major disadvantage in having these online things, that, you know, we can't have that interaction. Like right now, I'm looking at a screen. I do not know whether you gentlemen and ladies are, drinking coffee or switched off and just thinking of doing something else. All I can appeal to you is be concerned, definitely. This is news headlines from just today. COVID turns eyes on kids. I mean, come on. Can you make it more distressing for parents? This is something that, it is, what's it? COVID turns eyes on kids. When looking at data, always look at the denominator. That means out of a population of how many? That is 10 cases out of 1,000 kids or 10 cases per million kids. So that is a very important thing to know. Unfortunately, social media tends to come out with gimmicky headlines like this. So we've got this monster COVID that is going around looking at children like that. Doesn't work. Ladies and gentlemen, there were cases in children in the first wave, in the second wave. There will be cases in the third wave and the fourth wave and the fifth wave. It is nothing unusual. Children are not falling extraordinarily sick. It was assumed because a few experts said third wave will affect our children. It's not happened so far. Don't worry. We have all now with work from home, looking at channels, TV channels. Just ignore news about Omicron. Ignore news about coronavirus. Don't let your children get worried. Don't let them hear these breaking news headlines that come about. There is nothing to worry about. In the past 3 years, there has been nothing new that we've learned in prevention. So why worry? When you can't do anything more, why worry? Take it easy. That's the basic message that I'm trying to convey to you. Keeping it simple. What I will do is, after this session of ours, this is a poster that we had created for the Tata Trust. It's a simple guideline for keeping children safe. Very simple, answering the frequent questions. We've taken a poll across the Tata group to find out what were the common questions that people wanted to ask, and we prepared an answer sheet for them. Simple 2 lessons. Be aware. That is, be alert to your child's health. Second, beware of self-medication, of over-prevention. Don't make your poor child do steam inhalation and burn themselves. Don't make them do over-gargling and stuff them with all kinds of medicines. Not required. A simple, balanced, healthy diet and a worry-free upbringing. That is what you want to give them. For 15 to 18 years old, all of you know now that vaccination has begun for them just this week. Covaxin only, they will get the second dose after 4 weeks. Again, don't hesitate. Get your children who are in this age group to vaccinate, but again, don't rush. Don't go to a crowded area just to get them vaccinated. In due course, they will also be covered. Till then, let them continue to practice and continue afterwards also to practice COVID appropriate behavior. You will be getting expert opinions. I mean, I hope Sanjeev didn't introduce me as an expert. I'm not an expert. I'm also in this pandemic with you. I'm also learning as you go along. Maybe the only difference between you and me is that I have an expert filter. I filter out information, what is all bunk and what is correct, because I do source selection from where I read my material. So whom do you believe? On the same day, you'll have a paper saying Molnupiravir benefits outweigh risks. And the other side, you've got one report which says the government says, don't give this medicine, it's got too many side effects. So who do you believe? That is the point. Who is the common man to believe? Well, I will just tell you, you should have this news filter on your own. That means you should check the source where you're looking from. Don't just believe that you get a forward saying doctor in China military hospital or in New York hospital or renowned doctor there has said this thing. Would you believe anything else like that? Well, in a country where we get stock tips on SMS also, I'm certain you would be very chary of these things. Be careful. Will Omicron infection give lifelong immunity to COVID? How do we know? Omicron's just come about. How can someone predict? See, there was a famous astrologer and a horoscope writer for these major leading dailies. Did he predict his own death? Could he himself say that, okay, I'm going to die on so-and-so date? Well, that's what happens. As they say, death and taxes, both are certain. This is the end. Was a song by those of you who are maybe older than 40 would know this group and they would remember the song, This is the End. But is it? This is the way the world ends, not with a bang, but whimper. T.S. Eliot said this in a poem of his, The Hollow Men. So is this how our pandemic is going to end? In a recent seminar, Dr. Udwadia, a Bombay-based physician, said, he may give 2 statements. So I put one as true and the other as false. The good doctor is a very experienced man. He said the pandemic will end because all pandemics burn out in the end, not with a bang, but a whimper. I would rate this statement as absolutely true. That's what's going to happen with the coronavirus pandemic, but no one can predict whether it will end in 2022, March, April, May, June, July, August, or 23. No one can say that. When it happens, you will not even come to know. You will suddenly forget about it. And maybe after 2-3 years, you'll see, yes, pandemic, it'll be like that. That's how human beings are. We have a very short memory when it comes to bad things. It's exactly the way it's going to peter out. In the 1918 flu pandemic, that's exactly what happened. After a couple of years, people forgot about the pandemic. And when the people were removed from the pandemic, that is, it became just panic removed. People continued. As simple as that. Then again, the good doctor said, WHO labeled Omicron as a virus of concern. The most exalted title a virus can aspire to. This is false. Because variant of consequence, the BAP of all variants is what we are all worried about. That variant of consequence has not come about as yet in this pandemic. And we hope, going by the trajectory it is taking, that should not come about too. We need you. We need you, your colleagues, family and friends to be supporting this COVID-19 vaccination campaign. You can play a meaningful role. Ladies and gentlemen, you can provide the correct information by yourself understanding what is correct information. You and your team can be social mobilizers. You can support this prevention and control of this pandemic in 2022 and hope for it to fade away. There is no final push. There is no thali beating required. It just needs us to live healthy lifestyles. It needs us to live in clean environments. It needs us to educate people around us about general hygiene and sanitation. Essentially, Swachh Bharat Abhiyan is a very true, a very correct Abhiyan. You can make a difference. I would definitely agree with this statement that, you can be the change that you want to see in the world. With that, let's hope that we have sooner than later the setting of this pandemic away on the horizon, and we'll have our freedom from the restrictions that have been placed on humanity right now. Now we will open the session for question and answers from you all.
Yeah.
Sanjit, I guess we're good for time.
Yeah, I think we are right on time. So now, folks, you can raise your hand and we'll pick someone and we'll bring them on the stage and we can have a live Q&A. Or maybe if you can also post your cues on the chat, and Doctor and I will pick them up.
Yeah, so we have Alvin Francis who's raised his hand.
Yeah.
Hi, sir. Alvin here from Bangalore.
Yes. Tell me, Alvin.
So, very curious to know when the vaccine will be ready for children less than 15 years. My son is 11 now, and he's fallen sick from yesterday. He's like having high fever and cold. Been to the doctor and they've given some medicine. Not sure like if medicine would be out very soon, or how's it going to be like? So.
Okay, Alvin, let me just reassure you at this point in time that, see, what has been the experience across the world is in the pediatric age, I mean, the children that we're looking at, you see the symptoms that they have, like a child, just illustratively, your child has got fever, he would have been given medicines for lowering his temperature. He should have been given a medicine and maybe an anti-allergic medication, and he would have been given some nutraceutical or a vitamin or something to support him. And hopefully an antibiotic would not have been started unless he had some localizing signs or symptoms. So this is broadly what is going to be the way it is. Just like your child would have had fever earlier growing up years before this pandemic, it should hopefully play out the same. So what we advise parents, especially now, once a child has got fever and you are suspicious that it could be because of the coronavirus, you need to be watchful of the symptoms that should not worse. So we are looking at, his pulse oximeter, that the thing you clip onto your finger. If it's less than 93%, definitely you need to, it's a risk factor that you need to go to a hospital to seek admission or even an opinion. If he has got a high respiratory rate of maybe more than 24 breaths per minute or maybe 30 breaths per minute, he's going like that, then again, it's a risk factor. If his fever persists for more than 3 days or more than 2 days, if it's more than 103 or something like that, I mean, your doctor would have warned you about these things. Those are the risk factors which we need to take into consideration when you need to take your child to a hospital. And not continue with home management. That is all. So there is no need to go and admit in a hospital at this stage, because there are other infections in a hospital where the child can get. So what I'm saying is, the same way that when growing children from the ages of 1 onwards, they get fever and are managed at home, is the same way we need to manage these and not be overly concerned. So when I said 2 things: be aware and beware. These are 2 other sides of the seesaw. You've got to be aware and you've got to beware. So I will just reassure you at this point, but I'll also tell you, please do keep in touch with your doctor so that you can discuss with him if any symptoms worsen.
Sure, sir.
And
Thank you so much.
The vaccine that you were talking about, let me just say, these vaccines are all new vaccines. Usually, I mean, before this pandemic, for a vaccine to come into the market, it was studied for 10 to 15 years of vaccine was studied. So the safety of it was fully understood. Now, a child below 15 is a growing child. Every part of the child is growing. He's growing into a young man or a young woman or whatever. So the regulatory agencies are always concerned about what may be the effects of such a vaccine on it. So it is a wait and watch system. They have to do trials. They have to even accelerate the trials and do. So it will come about someday. I mean, the timeline, it all depends on the political pressure that is there or the pharmaceutical pressure. The vaccine will come out for younger children, but ethically and morally, they would want to do the studies before they establish the safety in this age group. I mean, which parent would want to make their child a guinea pig for this if it's not 100%, or let me not say 100%, at least 80% safe. It's like, say you can put a gun to your head and say, is this going to, there a bullet in it or not? Only by clicking it, you'll know. So you want to have, even cosmetics are tested. It may not be on animals, but they still are tested. So vaccine is something that's going into your body. So vaccines for children will come about. It's just a matter of time. It is a matter of the study getting completed and follow-up being done.
Great. Thank you so much, sir.
Pleasure.
Doctor, let's bring one from the chat.
Yeah.
So how does one increase immunity if they are very prone to respiratory issues?
Okay, how does one increase? Okay, so we have got Arundhati is asked, how does one increase immunity? Well, it's a very interesting question, because see, right from the time of our Vedas, when we've had rishis and munis in the Himalayas standing on one leg and propitiating the gods, everyone has been working at trying to get our immunity boosted. So Ayurveda has got a whole range of immunity boosting products. We've got an entire multi-billion-dollar nutraceutical industry which provides supplements to boost immunity. And I would say that a balanced lifestyle is the best approach. That means you get exercise, enough of exercise, you eat healthy, you eat not just a vegetarian diet, you eat a balanced diet. That means a little bit of non-vegetarian stuff, a little bit of the correct amount of micronutrients, and a little bit of healthy attitude in life. That is what will boost your immunity. There is no one magic tablet or pill that you can pop and say, okay, my immunity is up. So it's an approach. Developing your immunity or boosting your immunity is an approach. It's a lifestyle. You can Google a lot of things, but about how to boost immunity. Depending on who is telling you, you'll have to believe them. So if someone is telling you selling you a product, well, that's a commercial push. So I would say holistically, when you look at it, Arundhati, boosting of immunity is multifaceted. It's like what makes you or me a good person? Who defines that? So what is immunity boosting? Immunity is considered the base of all our responses of our human body today. We are recognizing that it is immunity that keeps us safe from cancers, from other diseases and infections. But how do we get it to work? It is not our puppet to control. So simple thing I would say, balanced lifestyle. Everything in control. If you drink alcohol, drink it in moderation. If you smoke, don't. Stop smoking. If you like laddus, don't stop laddus. Eat laddus. It's good. If you like palak paneer, go ahead, eat palak paneer, but don't eat 1 kg of palak paneer. You will get nothing but green stools. If you like chicken, eat chicken, but not the full chicken. So what I'm just giving an example is balanced. Everything in moderation, keeping a stress-free mind, being calm, doing yoga is very good. There are various forms of yoga. If you look at any yoga app, it talks of immunity boosting poses. Yes, those do work, but not in isolation. So you can't say, I'm going to drink, smoke, do everything, and then do yoga. Health is a lifestyle. It's a choice that you make. Yes. Can we go on to another chat?
Doctor, one more. It's related to children.
Okay.
So how severe are cases in kids aged 6 months to 2 years?
Okay, now the same way I'll just ask the persons who are listening to this right now. I'll ask them that if you all have a Maruti car, will the Maruti car have the same mileage? All Maruti cars. Each Maruti car, depending on how you drive it and how the road conditions are, etc., will have different mileages. Why does one expect the human body to behave the same? Each child, each human being is a unique person. Each child or human being's body's experiences different symptoms and signs based on their response to a particular disease. So I would say severity depends on how severe the infection is and the child's body, how badly is it reacting to it or not reacting to it. So it is nothing about, that all children will have this. Some children will be very lucky and get away with minor symptoms. Some children will be a little bit unfortunate. They might get a little bit more severe symptoms. So, well, it is just I would say, luck of the draw, and seeking care at the correct time. Do not delay, but do not rush. It's a balance that every parent has to learn to strike. You have to understand that. There was a person had asked about her mother's blood sugar level and that whether she can take vaccination. Absolutely. Anyone can take vaccination. It's perfectly safe for them. They should continue taking their medication for diabetes. They should continue taking whatever medicines they want, and they can take the vaccination. It's perfectly safe for them to take it. Then there was something, I'm feeling a little bit change in smell sense and taste sense only. See, it's like, at this point in time, we would suspect everything to be COVID. But even if we suspect it to be COVID, is it COVID? What difference does it make? If you are sick, you are sick. Why do you want to put a label on it? I mean, yes, there is a government is reimbursing those people who die because of COVID. So yes, you might want to think of that angle. After all, this is a session hosted by Plum, which is an insurance aggregator. So when you look at it from that point of view, I would recommend not to get tested unless you need to be hospitalized. In routine, if you have this, this, I can't smell this thing, maybe that day your cooking was not that good, or maybe that day you had, a stuffy nose, let it be. Don't bother, don't get tested. It's too much of a load right now. Don't. The latest ICMR guidelines also are talking about this. If you're asymptomatic or just mildly ill, don't get tested. I mean, what is it adding to one of the numbers there? I mean, instead of having 1.3 billion, we'll have 1.3.1111 billion. What difference does it make? You're just in the statistic. So don't unnecessarily get tested and don't get perturbed. So these are just symptoms. Symptoms can be commonized. Now we have, can a person test positive with Omicron even though the person hasn't tested positive before in first and second wave? Okay, young man Karan, let me just say that Omicron is a variant of the coronavirus. That means it is Chota Shakil. You got Bada Shakil, you got Chota Shakil. Now this variant of the virus is still the same virus, coronavirus. It's got just a different mutation form. So if you didn't get infected in the first wave and you didn't get infected in the second wave, lucky you. And if you don't get infected in third wave, even better for you. So why do you want to get tested? Omicron, you tell me now, when I say that the prevention measures are the same, it's, for example, if you are driving a motorcycle and you're wearing a helmet, and a helmet will safeguard you from hitting against a road or a cyclist or a truck, then what difference does it make to what you are hitting against? Let it be. You can get positive with any strain, no concern. The treatment, the management, the diagnosis, all the same. It is just that now Omicron, we are finding that you may be positive for Omicron, but negative in the RT-PCR also, because of the way that it's got some genetic mutations that are not being detected. So, okay. I mean, there is no medal being awarded for being infected with Omicron. If there was just 10 cases out of 100 million, yes, possible. Okay. Anything else? Yes, we have Shadab. Yes, Shadab, tell me.
Yeah, hi, sir. Good evening.
Good evening.
So, sir, I just wanted to ask you about COVID the self kit. So, I'll tell you my case. Since Friday, I was not keeping well. I was sneezing and I had cough. So I went to my family doctor. He gave me medicine. Sunday, I did a test. It was negative. Yesterday, on Monday, I went to office. Yesterday, I again went to office. I did a test again in the evening. So वहाँ पे दो lines होता है. One is C and one is T. The line came on T. I sent it to my doctor. He said it is positive. Self-isolate. When I sent it to my boss to apply for work from home chutti, he said, "Beta, this is negative. It has to be both the lines." So I am in a confused state of mind at the moment.
Okay, now I'm going to ask you, Shadab, I'm going to ask you here, in your organization, is your leave policy based on you sending in a test report or a medical certificate?
For this, it's test report.
Okay, so maybe you need to ask your HR people to maybe get in touch with me or some other person, whoever is person of their choice. Let me just say here, you see, you have to isolate not because you've got a test positive. You have to isolate because of your symptoms. Now your symptoms are what, you see, what happens is if I do the test today, I've been spreading the disease to people for the past 2 to 3 days. So I've already exposed everyone before that. So right now I needed to, so that I don't spread it further. So looking at a test diagnosis, it's actually meaningless. It is more that you should rely on the symptoms. And the symptoms, if you discuss with the doctor and the doctor is ready to give you a certificate for it, that is a better way out rather than asking for a test. Because there are things like, false positives, false negatives, and especially the rapid antigen test is prone to these errors. I mean, sometimes when you're putting in the swab, you might not get the angle correct. At that point
Okay.
where you sampled it, there might be no virus because it's all dependent on the viral shedding. No? It's not like a blood
Okay.
test being taken. So there are potentials for you to have errors in the measurement technique itself. So my recommendation here is for all the audience here, you must advise your HR people that it is symptoms that are important. When you feel unwell, self-isolate yourself. Assume that you've got coronavirus if you feel unwell. If you've got any of the symptoms that you keep reading about in the paper, self-isolate. Within 4 to 5 days, you're okay. I'm certain that much of leeway can be given in this pandemic for staff. As organizations today are very employee friendly. So I'm certain
Right.
maybe they haven't been given the correct advice. So it's okay. You can just tell them what I'm telling right now. Okay.
Okay, thank you, sir. And I am well now. I don't have fever. It's just dry cough. So I think I will get well in like 2-3 days.
Yes. No, but absolutely. But please do remember, Shadab, that if you are infected with coronavirus, you have a chance of getting a complication. That means don't neglect yourself for the next 1 to 2 weeks. You continue
Okay.
eating healthy, do gargling, eat this thing, the healthy food, green vegetables, so that you get your immunity level up. Like we were just asking earlier, do all measures required to keep your immunity level up.
Okay. Sure,
Okay.
sir. Thank you.
Yeah.
Thank you.
Anything else? Sanjeev, have you missed out any chats?
Yeah, doctor. What's the incubation period for the Omicron variant?
Okay, now see, what does incubation period mean technically? It would say, like, those of you who know how to cook or to bake, it's when you put in batter into a mold and put it into the oven and the cake is ready from it. That is the time. See, you can't eat kacha batter. Of course, kacha batter is also very tasty for those of you who have eaten it. But when you bake a cake, it is when it is ready. That is when it is ready to eat. The correct temperature, the correct duration. Same way, incubation period means from the time of entry of the virus into the body to the manifestation of symptoms that you are feeling. So that is incubation period. Now, incubation period can range from anywhere from 1 to 3 days to 5 days. And as Omicron is relatively new on the scene, what we are fixed on right now, it is 1 to 3 days. We can say if you start feeling this thing, you have got infection. But it doesn't make a difference because you have already transmitted to people around you before that, before you start developing symptoms in the earliest stage. So this thing is about viruses. They take hold in your system and they start shedding straight away. The virus wants to survive. That's the basic bottom line. Yeah. So we have
Sudarshan on the line.
In the meanwhile, you can just check if we missed out any chats. Yes, Mr. Sudarshan.
Good evening, sir. I have one question for you. Is the precautionary dose or booster dose is reliable?
Okay, now let me just say here that I personally would prefer to call it a booster dose. This is just spin doctors who are calling it a precautionary dose. There's no such thing as a precautionary dose. It's either you wear a helmet or you don't wear a helmet. You don't do precautionary helmet. Doesn't even wear a precautionary helmet. So it's just English language. Don't worry about that. A booster dose at this point of time appears to be indicated. That means so far it seems that the immunity that you got from 2 doses, it does decline. And so we are not taking a chance. That means the scientific community is saying, as there is no harm in taking a 3rd dose, if you give the 3rd dose, this dose will boost the immunity level to an acceptable level, which no one knows as yet. It is being studied. So that's why I said, get in the line definitely, but don't be the first in the line. There is enough vaccine available. Booster dose ki bhi bari aayegi, par zarur lena, but aram se lena. Don't be in a rush. Jab bhi bari aayegi, tab lena. Like you have been reading in the papers, there's one gentleman, unhone 11 baar vaccine lagaya. Matlab ki har mahine jaake ek tika lagate the. Aise nahi karna. So the protection it will provide, I'm certain it will work, but that we can only know in time.
Okay, sir. Thank you, sir.
Yeah. There was, I think, one last question. Sanjeev, are we good for time?
I think, yeah, we have 5-7 minutes. There are 2 more.
So someone has asked, how reliable is RT-PCR? Someone I know found positive one day and negative the next. Let me say, just like any other test, there is no 100% guarantee. And what is an RT-PCR? It is just taking small, whatever it can find, it is amplifying that DNA, RNA that is there, that genetic element, multiplying it so it can be detected. Everything is prone to error. There's no 100% proof that is there. So whether it turns positive or negative at that point, in fact, if you ask me honestly, I would say we should stop testing now. There should be just sentinel testing. That means surveillance testing. On a community level, we should stop testing. And that's why the government has recently, in fact, I think yesterday or day before only, they've released new guidelines. They're saying decrease the amount of testing totally. Only those who need to be hospitalized should be tested. They do not want you to get tested for travel domestically. They do not want you to get tested for doing surgeries. All of those that they worked out there. So I would say that, see, RT-PCR is a good test, but this is the only disease so far in history of mankind of medicine that we have investigated on a population level with RT-PCR. इसके पहले तो थोड़ा होता था कल्चर वल्चर कर दिया ठीक है. RT-PCR is saying is the virus present or not, but if the virus is in very tiny amounts present, how will you detect it? That's the point. So every laboratory test is prone to error. This is one of those things. It can be positive in two laboratories, negative in another laboratory. But why bother? You look at the symptoms, na? If you look at symptoms, you'll be more effective in managing it. Okay. Anything else?
So, Doctor, we have one more folk on the line.
Yeah.
I think one. Raghavendra.
Okay. Yes, Mr. Raghavendra, tell me.
Good evening, doctor. So this is regarding my wife. She's pregnant. So what happens? I would like to know some preventive measures for her. And one thing what we have seen recently with her is while she tries to eat, she starts to cough. Otherwise, there's no coughing at all.
So did I hear you correctly to say that she's pregnant?
Yes.
Okay.
Yes.
So your question was that in a pregnant woman, what are the precautionary measures one should take?
Yeah.
Okay. Very simply, exactly the same as any adult who's non-pregnant also. A pregnant woman is more at risk because her immunity is lower. The reason her immunity is lower is that pregnancy is a stress on the body. Pregnancy is taking care of two people. It's two lives are there in one life. And that is why it is very important for the pregnant woman to eat very well. She is eating for two. So her immunity level has to be boosted accordingly. She doesn't need to take any extra supplements. Mr. Rathore, where you belong to Rajasthan?
I belong to UP, but I'm based out of Bangalore right now.
Okay, so fine. So anyway, the simplest thing is, if you see in our cultural traditions, what diet pregnant women are given is very healthy and very nutritious. They talk of giving them panjiri. They talk of giving them, desi ghee. They give them a lot of green leafy vegetables. So all of these are very important for a pregnant mother to take. So she takes the regular diet that the pregnant woman should take, which is for two people. That means her and her baby. Rest is all fine. Don't worry about it. The risk level is slightly higher because, like I said, pregnancy is stress on the body and stress lowers immunity. So that's why you need to focus on the immunity.
Thanks a lot, doctor.
Yeah. Welcome and all the best.
So, Doctor, we have one more folk on the line. Parul,
Okay.
can you? Yeah.
Yeah. So in continuation to Raghavendra, the question, Colonel, just wanted to have understanding, are this pregnant women eligible for the booster doses?
See, as of now, you must understand firstly that why this is being done in this phased manner. We are a large country. We're a huge population, and we've got a large number of older people. We've got a large number of pregnant women. We've got a large number of everything. It is just stratification. That means they're saying that, okay, let us first give these groups and then we will open up to the general public. In the meanwhile, studies are going on for this third dose. You see, even in the first and second doses, it was not immediately that pregnant women were given. It was after some time gap because they gave it to a select sample of pregnant women to see, will it be safe? Will it be safe for the baby? Will it be safe for the mother? After safety was established, then they give it to the women. So same way now, studies are going on side by side where pregnant women are being studied for the third dose. So it will come about, but I would say maybe within a month and a half, maybe let me just step out on a limb and say definitely by Women's Day, 8th March, definitely the third dose for pregnant women should come out.
Okay. And what will be the ideal time of gap between the doses? So for example, if I have taken, my these COVID vaccination in the starting of year. So what should be the ideal time between the booster dose and the last?
See, Ms. Parul, what the government has given guidelines right now is that it is 9 months from the second dose.
Okay.
Okay, so 9 months from the second dose, it is like the gestation period of a baby also. It's 9 months is right now, it is a reasonable gap. There are, in the Western world, they're going for 6 months, but we are going for 9 months. It is only time going ahead. If you remember, we first had a 4 weeks gap between the vaccine, then it became 12 weeks, then it keeps on changing like that. That is because as studies come in, as immunity levels are noted, accordingly, people, the governments and the regulatory bodies change their evidence-based statements. It is a very good stance, I would say, to change policy based on evidence as it comes. I'm not saying any hum to yahi denge. So as of now, as on today, 12th January, it is 9 months from that second dose that you are eligible for your the booster, the third dose, the booster dose. So what I would say is, whenever you're due, do go for it, but don't be in a rush to go for it. It's not that, okay, on the 39th week, Monday, you have to go and get it done. It can be done anytime after that. Jab time lagega, chale jana uske liye, as and when it comes up. So any other questions you want, Ms. Plum?
So talking about the change in policy, the self-isolation period also I have seen, has changed multiple times. So it started from 14 days and now it's 3 days. So what is the ideal self-isolation time?
See, the ideal self-isolation time, firstly, you must understand, isolation means that those who are cases are the ones who have to, that means those who've got the infection in them are the ones who have to be isolated. That means you keep them alag se. Whereas those who are exposed are quarantined. These are both may mean the same, but they're technical terms. So isolation is basically you are doing it to safeguard others around you. So that is why the time frames have been revised. As you said very correctly, from 14 days, it's come down to 7 to 5 days. And sooner it might come down to 2 to 3 days. That once you have been diagnosed or you feel symptoms, within 3 days, you'll stop being infectious. It is all evolving information. It is about transmission of disease. How much are you going to transmit? So ideally, I would say at least 3 to 5 days, you should stay away from your neighbors, relatives, friends, when you have any symptoms that you feel. Ideally.
Okay. All right. Thanks a lot, Colonel. Yeah.
Anything else, Sanjit?
I think we are mostly done, but if people want to share their queries, they can share at wellness@plumhq.com, and Doctor and I will work on them and share it back to you in the next.
Yeah, sure. If we can wind up then, Sanjit, then I'll just thank the participants. Thank you so much for your time and patience. And please feel free to ask the questions or concerns you have. We will address it in the FAQs. You can go through them. It'll be of benefit to look at others' questions also, because it's the questions are same for everyone. In my experience, it's the common doubts that we have, and those are the doubts that we all need to tell our friends also about. That okay, this is the kind of thing, the information that's out there. And don't believe messages on WhatsApp. The biggest enemy of mankind, WhatsApp.